Hello and welcome to this episode of DMC's Medical Matters. Today we are talking about conservative treatments for chronic back pain due to arthritis. And joining us today from DMC Rehabilitation Institute of Michigan is Dr. Mahmoud Sabbagh, a pain specialist as well as a physical medicine and rehabilitation physician. Welcome, Dr. Sabbagh.
Thank you for having me.
So let's get started. How common is arthritis of the spine and how do you diagnose it?
So arthritis of the spine is very common. We have to understand that arthritis is a degenerative process. It's a process where the joints will wear down over time with age. And the vast majority of patients will develop some level of arthritis. And it's diagnosed with a simple plain film x-ray. We can become more advanced with MRIs and CAT scans, but all it really takes is an x-ray.
And can it be cured?
Arthritis cannot be cured because it's a degenerative process. So what happens is, over time, as the joints continue to wear down on each other, you'll start to have some findings of bone spurs and cartilage loss, and this can translate into pain. It may or may not translate into pain. It's not curable because once the joint in the spine is worn down, it's not reversible. And the only way to treat it is with conservative care or more advanced treatment options.
And what are some of those conservative treatments?
So the conservative treatments, first and foremost, is lifestyle modifications, right? We want to try and identify what the patient is doing that could be aggravating their pain. What type of lifestyle are they leading? Are they in a regular exercise program? Are they training? Are they strengthening their muscles, stretching on a regular basis? And if they are not, we want to kind of guide them into that path. If they are doing that, sometimes we move towards simple over-the-counter anti-inflammatory medications just to try and bring the inflammation down. And if we have to go further than that, physical therapy is the most effective. If skilled formal physical therapy is done appropriately in the right setting, it'll be very effective for this type of pain.
In your practice, one of the conservative treatments that you use quite often is a radiofrequency ablation. Can you tell us a little bit more about that?
Absolutely. A radiofrequency ablation is one of my favorite procedures because I find it to be so effective. It does have different names. Some patients may have heard of a rhizotomy, or some patients refer to as burning the nerve. But if a patient has back pain from arthritis, and if it's diagnosed properly, a radiofrequency ablation is one of the most effective procedures and give long-term benefits. What the procedure entails, and this can be done, it's an outpatient setting procedure. Sometimes it can take 10 to 15 minutes, could be done just under local anesthesia, it doesn't require sedation. And it's using very fine, small needles that are directed towards the nerve using image guidance so that we can see where we're going exactly. And using electrical signal, we can disrupt that nerve. So the radio frequency is sending an electrical signal to that nerve to basically denervate it, to denervate the joint. We're trying to cut off the signal to that joint. So even though the arthritis is there, if the patient has failed conservative treatment, we can stop that pain signal from going up to the brain so that the patient can now participate in a more aggressive rehabilitative process so that they can further improve their health and strengthen their core so that they're in less pain.
And what is recovery like from that procedure? So
the recovery is quite simple. The patients will receive immediate relief. It's not uncommon to have some soreness at the site. Nothing significant that's going to require restrictions, but just some soreness at the site that can last a couple of weeks or maybe up to a month. And typically after that, the patient can enjoy pain relief for sometimes up to 2 years. Now, again, if it's done in a setting to where after the ablation, the patient really focuses on core strengthening and rehab and a healthy lifestyle, at times when this nerve regrows, and it will regrow over time, when it does regrow, the pain will not be as bad because now they've strengthened the muscles around the joint to offload the pressure off that joint and hopefully lead a not pain-free, but a life with little back pain.
And if someone has chronic back pain, why is it important not to delay care?
That's a great question. It's important not to delay care because we have to remember most causes of pain are inflammatory, okay? And that will usually resolve on its own within days or maybe a couple of weeks. Once we enter that chronic phase of pain, there's a whole cycle of events that are occurring, right? Muscles start to change, blood flow to the region starts to change, right? Your sleep habits start to change, your mood starts to change, and it really is a cycle of events that starts to tailspin and become far more difficult to treat the longer that you've delayed the treatment or the longer that you've waited. So if we can diagnose the condition early enough and treat it early enough, it makes it that much easier to treat and improve the success rate for the patient.
Well, thank you for that great advice, Dr. Sabbagh. And if you would like to learn more about surgical and non-surgical treatment options for chronic back pain, please visit dmc.org/spinecare.